Dear colleagues, I'm Yong-Dae Kwon coming from Department of Oral Maxillofacial Surgery, Kyung University, Seoul. It's my big pleasure to give a talk in this very first online ITI World Symposium. I'm going to talk about the decision-making of sinus flow elevation. It's really evident to carry out lateral window in a case with 2 mm of residual bone. But we have a gray area like this where the residual bone height ranges 4 to 6 mm. In this condition, both approaches are still valid. For the decision-making, other clinical factors like clinician's training background and the missing tooth location should be considered. For example, this is a single molar replacement with 4 mm of residual bone. In my hand, lateral window was comfortable, but you can also have a chance for transcrestal approach. So with this approach, we can have a direct vision of the surgical field. Any intraoperative complication can be witnessed, and you can control things happening in your hand. Besides clinician's training background, when choosing one approach, patient discomfort often deters the choice of lateral window because we really care about the patient. Let's give a look to how your patient feel. From the patient point of view, there was a study investigating how the patient liked the surgery. They were asked at the 14th post-operative day. From this study, although a handful of people who got lateral window went through kind of unpleasant experience, the difference between the two types of surgeries was not considerable. So patient discomfort would not be a main determinant for the choice of approach. Moving on to the outcome, looking out for some literatures